Today the lesson is public health and the government, right? So we are the citizens of this government of India. As a citizen, we expect many of the basic needs to be given to citizens by the government. It is a responsibility of the government to fulfill the basic needs of the people, like clean drinking water, then proper sanitation. That means the sewerages should be closed, then minimum food for all, then education, health facilities are required basic things for all. These should be given to all. Okay, what these all the basic needs should be given to all. No one is excluded from getting these basic needs. Okay, because all the citizens are equal, right? There is no partiality with the government regarding the citizens. So all the citizens are equal in front of the law. So these basic needs have to be given to all the people in all the situations. So today in this chapter we will find out how health facilities are given to the people, how far the provisions of the constitution are satisfied in case of health services to the people, by taking a case study given here in the textbook. There is a case study. Using the case study, we will find out whether we are satisfying the provisions of the constitution or not. Okay, that means the constitution says that all the citizens should be given the basic needs. It's a provision in the constitution. Okay, so whether this provision of the constitution is satisfied or to what extent it is satisfied, we will learn here. Understand, right? See, we know that many of the people are suffering with different diseases and health sicknesses. So to prevent and to treat illnesses, we have to go through the facilities like health centers. In India or in any nation, we find that many are sick people, right? To have good health, we need to prevent sickness. So for that, we need health centers, that is hospitals at different levels, laboratories. We need to find the reason for disease or the what to call the sickness, and ambulance services we need to carry the patient immediately to the hospital. Blood banks are needed to donate blood, right? And we need appropriate, that means qualified technicians, that is health workers, We need qualified health workers, nurses, doctors, lab technicians. All these are qualified health workers we need. They can advise and diagnose. That means finding out to treat the what illnesses. We also need what you call health workers. That is medicines we need. What we need? Medicines, right? And equipment to treat the patients, like a scanning machine, microscope. As we go to the hospital, we find several tools and equipments in the operation theater, right? All those we need for treating the patient. MRI scan, right? Total body is scanned. 2D echo for treating the for finding the these symptoms, right? Then they will go on using different equipments to see that what is happening to the patient inside the body, right? And to prevent these kind of illness, we need to go through the vaccination. What is that? Vaccination is needed. Along with this, we also need enough food, that is nutritious food, right, which gives energy and to fight with what to call diseases and what to call sicknesses. Understand? To overcome the sickness, we need to improve the immunity power. Immunity power comes with nutritious food. So we need enough food and safe drinking water. Much of the health problems we face from water, right? If the water is not safe drinking water, there many health problems have to be faced. And we need proper sanitation. That means the closed drainage system. Our environment should be very neat and clean. So all these are required to keep our health good. Okay. So all these are essential to have a good health. In our India, we have large number of doctors, hospitals, and clinic centers. We also have experienced and knowledge one people. That means we have what to call public health care systems very well in India. That what we call the system of hospitals and health centers which are run by the government. Okay, the government is running public health care systems and health centers to meet the needs of the people, that is who spread over lakhs of villages, right? We find that near about 121.01 is the population of India, right? So we have a huge population, stands second in the world now after the China. So to all these people, there is need of health care facilities. So the government how to meet the required health facilities of the people all over the India. That means in a small village, also we need a small clinic center, maybe one hospital, which could meet the needs of the villagers. And moreover, we have much advancement in medical sciences, that is in the form of technology and treatment procedure. Today we see that many of the works are done by the using machines which run on technology, right? Some of the operations are done by the using the technology. So there is a lot of advancement in the medical science in treating the water patient. Do you know that India is the fourth largest producer of medicines in the world? We are at fourth place in production of medicines and also exporter of medicines. To many of the countries of the world, we are exporting our medicines, and we have large number of medical colleges in the world. Do you know that in India approximately 15,000 new doctors are qualifying every year? 15,000 doctors are getting qualification every year. And healthcare facilities, that means hospitals, clinics, primary health centers, like this, many have grown substantially. That means in a large number we have healthcare facilities from 1952 till today. In 1915, there were in India 2,717 government hospitals, and those increased to 11,174 hospitals by 1991, and it increased to further, there is an increasement, that is 18,218 by 2000 year. That means there is increasement in the health care facilities in India from 1951 to 2000. We are in 2020, and due to the corona situation, number of hospital facilities have increased. Recently the government announced NIMS, the bed facilities to the patients increased, right, to meet the what needs of the people, to treat many lakhs of the people, many lakhs of the patients. We need to improve the what medical facilities. What in by medical facilities? It may be a primary health care center at a village level. It may be a small hospital at a divisional level, at a mandal level. It may be a big hospital at a district level, at a state level. Okay, we'll discuss all those things in the later class. Okay, so many healthcare facilities have to increase to cater the needs of the water sicknesses. Understand? So here we see that for some people the best facilities are available, and for some others we do not have basic healthcare facilities. Do you think that all the people are getting the best facilities of healthcare in India? If you open the newspaper, we find some are what to call going to death. That means they are dying as they are not getting the treatment in time, right? So this is contrary to what the Indian constitution desires for all. What is there in the constitution? Constitution says that all the citizens of India should get medical facilities, health care facilities, right? So are we getting health care facilities up to the principle which is in the Indian constitution? Okay. So what we have to do, understand? We have enough money, understand, knowledge and experience to change this situation. Which situation? That situation where some people are getting the best facilities and some other people are not able to have the basic facilities. So how can this be done? We will discuss in this chapter how to provide health care facilities to all the people in the best manner. Understand? So to understand this, we will look into the a case study given in the textbook. Okay. Here is an example. Here is an example to understand how are healthcare services in India. Understand? Let us see this example. Kiran and Sarita, they are classmates in a school of Karimnagar. Okay, they are very close friends, and Sarita comes from a well-to-do family. What do you mean by well-to-do family? It is a rich family, we can say. She is in rich family. Who? Sarita. Sarita is in a rich family, whereas Kiran is at a poor family. That means his parents are struggling to meet their needs every day. Understand? As school start by June, which is the rainy season, right? Rainy season, in the sense, it is a season of health problems, right? The rainy season had just ended there, and there was an outbreak of viral fever. After the rainy season, we see that viral fever starts. So both Sarita and Kiran, they fell ill at the same time. When they were back in the school, they talked about their illness. That means they both, Sarita and Kiran, they suffered with illness and they went to the doctor. They got treatment. After recovering from the illness, they came back to the school. After coming to the school, they started discussing about their illness. So, what was the discussion between Sarita and Kiran? Okay. Soon after Sarita got a fever, she started explaining. After suffering with a fever, Sarita's father took her to a private hospital which is near to the house. Understand? There, Sarita's father paid 100 rupees at the registration counter. They were given a card and asked to wait in the hospital. You know that when we go to private hospital, we have to take one receipt by registering our name, paying 100 rupees. That was 100 rupees here given. But today, in most of the private hospitals, they are taking 200 to 300 to treat the patient. That is a ticket. That is what you call it is a receipt to treat the patient. Understand? So here Sarita paid 100 rupees at a registration counter that she registered that she has to get what treatment by doctor. Okay, then she was given a card and she was waiting to visit the doctor. As the doctor saw her, then doctor recommended to go for a blood test. You know that today many of the patients are getting fear to go hospital. because of the expenditure. Understand? Today it is a corona situation. Many of the patients who are suffering with the corona, they are what to call paying lakhs of payment. I have heard some of the patients who are suffering with the corona, they paid it's near about 70-80 lakh rupees. Then also they did not recover, they died instead. And the corona patients are not getting the treatment today sufficiently, right? So what do you call, this is a situation we see here. So coming to the point here, as Sarita visited the doctor, that means as she reached the doctor, doctor recommended her to go for a blood test and x-ray of the chest because to find out what is there. So they went for one counter where blood test will be taken and x-ray instead. When they came back to the doctor with the test, then based on the x-ray report and blood test report, the doctor has given what to call the medicine. The doctor prescribed a medicine for the fever and asked them to visit again the following day. That means the next day after the test results. The following day, the doctor went through the test reports and everything was all right. Then he felt that Sarita had a viral infection. By the report, the doctor got a conclusion that she suffered with a viral infection and there was no cause for worry. That means there was no worry. It is not a severe fever. It's a normal fever with viral one instead. So he prescribed what several what to call medicines to the what Sarita understand, right? And after that she was feeling much better when she back to school. This is the position and the situation how Sarita has gone for medical care, right? Let us look at the Kiran situation, who is a poor family. Understand? Kiran also suffered with a fever. Understand? He was suffering fever and body ache. Right? His father could not take time off his work because his father is what daily worker, so he was not able to get sufficient time to take the Kiran to the hospital. Understand? So they went near to the government hospital. Understand? After 2 days, see, after the 2 days of suffering with the fever, Kiran was taken to government hospital. They were standing in a long line, okay, which is a big line there because the government hospital, we see that a number of patients will visit. Those are not affordable to pay the medical expenses. Those are poor. They go for what government hospital instead. So in the government hospital, Kiran had observed that many of the people standing in a line. That is early that day. Early that day. Early that day means in the sense by morning 6 o'clock, maybe morning 7 o'clock. There many of the patients standing in a long queue, long line. Kiran was feeling very ill and he was not able to stand there. Such energy is not there to him, right? So, but he doesn't have any choice to meet the doctor immediately. Instead, finally, after waiting for a long time, they what to call they had waited there 3 hours. After that, they could reach the doctor. After doctor examining the Kiran, doctor said that they should go for a blood test. After long hours of waiting, near about 3 hours, they had wait in a line. Then after the doctor, they reached the doctor. The doctor said that suggested to go for blood test. Understand? Whereas Sarita, she have gone for a immediate blood test. Understand? And the blood test, they have stood for 2 hours. There also a long line, right? And they were told to these Kiran and their father to come the next day to collect the report, because already there are many patients in front of the what to call blood test report center. Understand? Where blood test they are taking, already there are many patients. So Kiran is suggested to come by next day to collect the report. Okay, so the same process again they gone through the next day. Understand? It was repeating. The doctor looked at the report and said that Kiran had suffered with a viral fever, and he prescribed some medicines for the fever and asked the Kiran to take a lot of fluids, that is liquids, and also suggested to go for rest. Okay, so in these days what happened, the Kiran has not attended school. Kiran got well, then after he attended the school. So what is the difference between these two? Sarita has got medical care immediately because she has gone for private hospital, where only some people who can pay the medical expenses at a private hospital, they are visiting the private hospital. Right? Kiran belongs to poor family. He cannot go for what a private hospital. So he has gone for what government hospital, where many of the people have gone to the government hospital. Right? Sarita really felt for the sorry for the Kiran situation. Understand? Because Kiran has gone very hardship, and she was very lucky because she has gone for modern private hospital where everything was done a smooth and easy manner. When Kiran asked her how much time and how much money she spent, then Sarita said that 3,500 they charged. That means to recover from the sickness, Sarita had paid 3,500 as the hospital charges and medicines. And Kiran spent only 100 rupees. Kiran expensed only 100 rupees instead. This is the what situation, what to call here in the private hospital and the government hospital instead. Right? So that tells that how the people are getting medical services, what to call in the hospital. Right? Here we see that Kiran paid only 100 rupees. Understand? So from this case study, we have to understand that what to call the health care facilities are divided into two categories. How many? Two categories. One is public health facilities. Okay, this example, this case study is given here to make you clear understand about health care facilities are two types. One is public health facilities, another is private health facilities. Sarita taken treatment at private health facilities, and Kiran has gone for what public health facilities. Instead, let us find out how these are giving what you call health services to the people. Okay, let us see that public health services